Hello, I'm Dr. Mark Trollis, and welcome to another video blog. Today we're going to speak about in vitro fertilization, the most advanced reproductive technology that's available today. Annually, in clinics across the country combined, over 150,000 cycles of in vitro fertilization are performed. Basically, it involves the removal of eggs from a woman's body, adding sperm to the eggs in the laboratory, allowing embryos to form and develop in the lab, and then transferring a select number of embryos into the uterus at a time that is optimal for implantation. Now, the basic cycle of in vitro fertilization involves giving a woman fertility medication to stimulate multiple eggs production from the ovaries. Before doing this, it's important to assure that a woman has a normal uterine cavity, and that can be determined by either doing a saline infusion sonogram, which is some water inserted into the uterine cavity under ultrasound, or it can be done by a hysteroscopy, which is a telescope through the cervix into the uterus, or a hysterosalpingogram, where we inject dye under X-ray fluoroscopy. Now, with that hysterosalpingogram, it's also important that a woman does not have what's called a hydrosalpinx, and this is a blocked swollen fallopian tube. And the reason we don't want a woman to have that is because fluid can seep back into the uterine cavity and actually reduce embryo implantation by approximately 50%. So the evaluation of the woman assures that her uterus is normal, she doesn't have a hydrosalpinx. We also assess her ovarian age by looking at a hormone level called anti-Müllerian hormone, as well as ultrasound to look at the number of small little cysts on the ovary that represent microscopic eggs. The man, of course, is a sperm analysis to assure that we have adequate amounts of sperm to fertilize the eggs naturally. If not, we can actually perform a procedure called ICSI, where we insert a micro needle, a micropipette, into the egg directly to optimize fertilization. Sometimes we actually have to go to the testes directly to obtain sperm, as if in a man with a vasectomy, or if he has blocked sperm ducts for other reasons, or in men who just don't produce enough sperm. So preparation involves determining how we can get sperm, and if we can from the ejaculate, or do we need to go to the testes from the man, as well as ensuring the optimal preparation of the woman with uterine cavity evaluation and to assure her fallopian tubes are not blocked, and also taking a look at her ovarian age. That lets us know how much stimulating medication to give her to produce a good number of eggs to retrieve. Now, this ovarian age testing does not predict pregnancy, but it tells us how much medicine to give. The medicine that we give is the same medication, essentially, what the brain signals the ovary to make eggs, but we give in much higher amounts to produce more than one egg on a monthly basis. Those injections are taken 1 to twice a day in various forms because there's different types of hormone injections, but basically there's a combination of FSH and LH, or just straight FSH. And that stimulation is done usually 8 to 10 days, sometimes 11 or 12. The longer the stimulation, usually the lesser response the woman is having to the medication. Now, during the stimulation, some form of ovulation suppression is used so that the eggs do not release prematurely while they're stimulating. And that could be in the form of leuprolide acetate, often called Lupron, or GnRH antagonists, cetrorelix or ganirelix, and that started in the middle of the cycle, whereas Lupron is earlier in the cycle. So we're stimulating the woman over the period of 8 to 10 days or so. She comes in every several days for a quick visit for an ultrasound and blood work to see her response. And then after the follicles, which are cysts with microscopic eggs, after they are of good size, we then give a hormone injection to trigger the maturation of the egg. Once the egg is mature, or all of the eggs are mature, then we bring her in for the egg retrieval, and that's performed under sedation in our surgery center facility right here. That procedure is done in usually up to 15 to 20 minutes. A needle goes through the vagina into the ovary and vacuums out the eggs. Once that procedure is over, the woman returns to the recovery room, and she's usually home within the hour. And then we give her the number of eggs that we were able to retrieve, and then the number of embryos the following day. In the next video blog, we'll talk about embryo development and the embryo transfer. So long for now.